Hi, I am Dr. Rochelle Bernavista Pacifico, a developmental pediatrician and a member of the PPS Southern Tagalog chapter. Today's topic is one that is often overlooked as it presents itself at a time when development is perceived to be relatively stable, largely predictable, and not so much vulnerable to potential risks. But any individual can be born with it, and unless properly recognized, may significantly limit opportunities in life. Therefore, allow me to speak on learning disability, in particular dyslexia, and our role as pediatricians in addressing this concern. James Wenderhoff, the executive director of the National Center for Learning Disability, had this to write in the most recent report that he has furnished the U.S. government and other concerned agencies. Stigma, underachievement, and misunderstanding of learning disabilities continue to be stubborn barriers for parents and children to overcome. The data in his 2014 report revealed that, left unaddressed, as many as 60 million individuals risk being left behind, burdened by low self-esteem, subjected to low expectations, and diminished in their ability to pursue their dreams. Such is how we envision children with potential learning disability today. And it is from this statement that I draw my objectives today to discuss the impact of learning disorders, in particular dyslexia in children, and to promote the role of pediatricians in early identification through surveillance and initiating intervention. This slide shows us a report from the Center for Disease Control and Prevention regarding prevalence rates of developmental disorders spanning 10 years from 1997 to 2008 in children 3 to 17 years old. The table shows an increasing trend with as much as 17% rise for any developmental disorder and at least 5.5% rise for learning disorders. The U.S. National Center for Learning Disability reported this year that out of the almost 2,000 individuals surveyed, at least 1 in 5 has issues in learning and attention, providing an estimated prevalence of 20%. 12% of respondents actually reported being diagnosed with a learning disability or LD. Based on statistics extrapolated by country for this year, at least 1.5 million Filipinos are estimated to have problems in learning. However, the Department of Education, Culture, and Sports only report an incidence of about 40,000 learning disabled school-aged children, where males outnumber females. These are extremely low numbers. That moves us to ask, where are the rest of them? The current scenario in the country is this. The government has shifted the primary educational curriculum to the 13-year K-12 educational system with the hope of equipping the Filipino child with education that allows him to be globally competitive while making our educational system acknowledged abroad. But this will be hard to achieve if the practice of mass promotion in the public school system continues, which I believe is partly due to a misconception of the No Child Left Behind policy imposed by the government to school officials. As a result, children are promoted to the next academic level based largely on class attendance and to some degree on class participation rather than fulfilling minimum academic requirement for the specified grade level. Moreover, being a third world country, inadequate resources are available to us, and the absence of screening policies for teachers and health professionals to identify those at risk for learning problems will continue to hinder delivery of appropriate intervention to affected children. A study done by Saludes and colleagues showed that Filipino educators and members of the local school boards only have a partial understanding and awareness of learning disorders. Parents, in comparison, offer little help as they have been found to have only a slight understanding and awareness of LD. There is also the public misperception on learning disability, as it is wrongly equated with mental retardation or intellectual disability, autism, and other sensory impairments, ushering in parental denial and subsequent misrepresentation in those concerned. Thus, the problem persists with no promising solution in sight. There are higher rates of school failure in all levels of education and lower rates of academic achievement. This inadvertently results to higher risk for unhealthy lifestyles in the future. In the report by the NCLD, they noted that 40% of respondents claim that they have experienced problems in learning at one time or another, and it is estimated that 12 to 20% will eventually be diagnosed with a learning disorder. Then of these, 5 to 15% will be specifically diagnosed with dyslexia. Dyslexia is a specific learning disability that involves reading in individuals with intelligence, motivation, and schooling considered necessary for accurate and fluent reading. They usually fall more than a grade level lower than expected. When identifying these children, studies show that assessment based on ongoing observations in school at 5 years of age is a reasonable predictor for literacy by the 7th year of age. However, most of the children only get assessed by the time they are in 3rd grade, which may be past the ideal time for intervention, which is best done before 8 years of age. Studies also prove that when children still read poorly in 1st grade, there is a 90% chance that they will continue to read poorly in the 4th grade, and if still left unattended, there remains a 75% chance of continuously reading poorly well into the high school years. This will definitely lower the probability of the individual pursuing higher educational attainment. What are the facts that we know regarding dyslexia? Well, we know that it is hereditary in as much as 50 to 80% of individuals have it present in another member of their family. It is a brain-based disorder involving the left temporo-occipital and frontal lobes that are necessary for language and cognition, and it is more common in males. Dyslexics have normal or average intelligence, but encounters difficulty with word recognition, decoding, and spelling. This will inadvertently lead to problems in comprehension and building up on their vocabulary. It is also often associated with ADHD, any of the language disorders and motor disorders. Subsequently, dyslexia becomes a frequent cause of underachievement, school failures, low self-esteem, and even depression. What is it not? That it is not specific for individuals with intellectual disability or autism, nor is it a result of poor instructional methods in school or parental upbringing at home. It is not a purely visual reading disorder as previously conceived, but a real language-based disorder resulting from a phonological difficulty in perceiving sounds. It is not true that it only occurs amongst the poor, although they are more susceptible to it. It is not difficult to recognize early if one would only look closely, and it need not be permanently disabling. While it can affect several aspects in a child's life, its impact can be modified as studies by Shaywitz on intervention in children between 6 to 8 years old showed significant and sustained improvement in their capacity to read, proving that early identification and intervention is key in ensuring positive outcomes. Our role, therefore, as gatekeepers of children's health and development is to be involved also in school-related matters through empowering ourselves with knowledge and awareness regarding learning disabilities and dyslexia, and actually screening children by 4 to 5 years of age especially those who are highly at risk due to familial tendencies or the presence of other associated conditions. Dyslexia can be suspected as early as 3 to 5 years old in those who present with language delay or persistently baby talk, those encountering problems in recognizing and sounding letters, blending sounds into speech, mispronouncing words like saying moan lower or for lawn mower or cat for cart. It can also be suspected in those with difficulty learning, remembering, and correctly using words. Also reliably determinant is observing difficulty with rhyming words. Among those older than 5 years old, they will be observed to be reading slowly or using illustrations to understand reading materials more rather than actually reading words for contextual understanding. They will have difficulty mastering rules of spelling, will evade writing or copying tasks, and manifest letter reversals when doing such. Most would rely heavily on memorization or sight reading than in decoding letters for reading. Difficulty working through word problems in math and in following a sequence of directions can also be signs of dyslexia. Short of formal screening procedures that can be costly, informal testing has been found to be good in detecting those who may have dyslexia, and it is highly recommended that we take some time to perform this simple test during these stages. During preschool and kindergarten or anywhere between 3 to 5 years old to have them identify or sound some letters of the alphabet. Have them identify the initial sound of a word or words that rhyme. For older children, preferably between 6 and 7 years old, a test that we can do is to have them read or spell nonsense words or consonant-vowel combinations that have no meaning. This procedure will detect even highly intelligent children with dyslexia. Arriving at a more definitive diagnosis would demand a developmental assessment and psychoeducational or IQ testing to rule out other causes for reading problems or other associated conditions. To initiate management, it is not necessary to wait until a definitive diagnosis is reached, but in our capacity as pediatrician, we can already inform the school of our suspicion, recommend the child for a formal reading program or for sped tutorials. Remember to ensure that the child receives the intervention preferably before 8 years of age, as problems in reading tend to persist if they are attended to only after this age. Counseling may be necessary as they will be prone to bullying, low self-esteem, or having poor self-image, and experience internalizing behavior problems like anxiety or depression. Medication may be warranted for associated conditions. Some tips that you can share with parents is to help them understand that it is not the child's fault that he cannot read. The parents and those concerned with the child's care should be reminded to avoid humiliating the child through public display of his weaknesses. Having the child read aloud in public is discouraged until such time that the child is more confident to decode words when reading. Parents must encourage reading at all times to avoid fear of reading. Teaching them how to read familiar signages and labels can build up their confidence for starters. Especially for those at risk, it is advisable to start exposing them early to written language like age-appropriate books and writing instruments. Parents are encouraged to regularize exposure and participate in these activities. Screen time, like watching television or videos and playing games in electronic gadgets, should be limited, as this has been found to lessen opportunities for reading and to shorten attention span and other cognitive skills for reading like active working memory, recall, and sequencing. In conclusion, learning disorders is a growing concern that would greatly impact on future educational and social-emotional outcomes in our children. They need not be very debilitating, as reliable methods for identification can be done during early childhood years, including informal methods. Still, a lot of them are left unidentified, therefore denying them of proper and early intervention. We, as pediatricians, are in a unique position to be actively involved through screening and early management in order to effect better outcomes in the lives of learning disabled children. Thank you very much for your kind attention. Please answer the questionnaire on the questionnaire page of this site, all for the Filipino child.